two, okay. 3, 2, 1, start.
Good afternoon, everyone. My name is Lucky, and this is my partner Bonnie. And today we'll be presenting our topic mental health issues in early childhood education in Hong Kong. So, our research problem is that most educators in Hong Kong are considered role models and they nurture young children's development. However, there's been an increase in educators struggling with mental health issues, such as affecting their teaching effectiveness, their personal well-being, and their learning environment. Although most schools acknowledges the importance of mental health in education, there's still a lack of recognition in view and structures and resources to bring awareness. This leads to turnover, burnout, and stress. The justification of the research topic is workforce stability, such as high burnout and turnover rates in HKEC curriculum, the staff retention issues, and cost of training new staff. The impact on child development, the effects of quality of care and education. Children is highly sensitive to their caregivers and emotional states if the teachers are always changing. And we want to know more about the recognition of EC workplace, mental health importance, EC workplace stressors, effectiveness of current interventions of EC educator. Next.
So we found that there are two articles is about a topic mental health of early childhood education in Hong Kong. The left-hand side one shows the information on how teachers feel emotionally and in their work environment and lack on relationship built within the work and the children's behavior. It has insightful strategies on how to better understand the situation of stress the educator. And the right hand side one is we chose it is because it's strongly related to our topic and is focused on the well-being behavior in educator in who in ECE Hong Kong content is follow two approach such as person central approach and well variable central approach, and it gives us a better understand of how different factors that affect the well-being of educator. These two articles both show us the insight on the relationship between work-related factor and mental health. Next.
So our main research question is, what are the challenges that increases mental health issues in educators EC curriculum in Hong Kong? And we use keywords to find this, such as issues, rise, mental well-being, curriculum. And our sub-questions are, what role do workloads and staffing levels play in contributing to mental health challenges among educators? And question two, how do mental health challenges of early childhood educators affect student outcome and the overall effectiveness of the school curriculum? These questions focus on the specific context that narrows the broader topic into our familiar local curriculum. Hong Kong EC system, and it researches on how curriculum implementation connects to the teaching demands and psychological well-being of EC educator. These questions identify specific areas needing intervention and supports us to explore the evidence-based solution. Thanks. We use the interpretism paradigm for this research. The focus is that our research aims on understanding more about the perception and personal experiences of the educators' mental health. Second is the qualitative research method. This paradigm is mostly related with the qualitative research method, which makes it suitable for us to analyze complex issues like mental health. We use interviews and focus groups. Third is the contextual understanding. It highlights the significance of context in shaping individuals' experiences. It focuses on the social and cultural dynamics of Hong Kong early childhood education system. Fourth is the holistic perspective. It is a holistic view and it considers the multiple factors affecting mental health and the teaching performances. Fifth is the social constructivism of reality. It recognizes the understanding of mental health in workplace, which is shaped by social interaction. It acknowledges the mental health perception that is shaped by social interactions. Next.
So after we know about the topic, we did the idea research approach, which is research according to the Hong Kong Psychological Society study. We found that there are 52.2% of teachers, educator, principal think that they feel hopeless, stress. They even have sleeping disorder. And within the number of 52.2%, there are 23% of their of them the stress level is very high. And also we find that the three top reasons of the stress is from non-teachings related teaching work and school approach. And teachers always feel unprepared on supporting mental health. They lack on training, studying into the teaching role. And this is a very important reason of teacher work stress is student emotional problem. Teachers always think that they cannot play a important role, effective role in student mental health issue. And these two things are connected together. So if one didn't solve properly, and then they will connect to each other and it happens again and again. So this is a cycle. To to know more about the topic and know more about the setting. So we have set the timeline of method. The first step is questionnaire. This is to provide to public and about the person mental health issue. The purpose is assess public mental health issue, find the early detection, and we want to enhance the awareness in public. The second step is observation to observe the real Hong Kong setting in local school. And the purpose is we want to know more real technological response. And also we want to identify the gaps and challenge it in the setting and improve the data also. The first step will be in interview. Individual interview to teaching staff, teachers, principal about their mental health and well-being while they working in the kindergarten. We want to gather better understand of the working style and working challenge, and we want to know more about their personal experience and person and individual perspective. The fourth step is also observation, but it's different to the last one. It is to observe the real setting in Hong Kong International School. So it can compare the differences and similarity to local school to a different environment behavior in order to make a comparison. And the fifth one, the last one will be questionnaire again, but this is also different to the first one. It is provide to public about result to mental health about improvement. And then we want to ask the teachers about their feelings and idea about the solution and improvement from the government. Is it really effective to them? And this is our research, the reference that we use for the research. And thank you. Thank you very much.
Thank you very much.